Does Tirzepatide show up on a standard urine drug test? If you're taking Mounjaro or Zepbound and have an upcoming employment screening or medical test, you might be wondering about this. Let's talk about what you need to know. Before we dive in, a quick note. This video is for educational purposes only and doesn't replace medical advice. Always consult your healthcare professional for guidance specific to your situation. The short answer is no. Tirzepatide is not expected to show up on standard urine drug tests. Here's why. Tirzepatide is what's called a peptide medication. It's a large molecule, over 4,800 Daltons in size. Standard urine drug screens simply aren't designed to detect medications like this. These tests are built to find small molecule substances of abuse like amphetamines, opioids, cannabinoids, cocaine, and benzodiazepines. They use antibody-based technology that targets very specific compounds and their metabolites. Tirzepatide is structurally and chemically different from anything these panels are looking for. It's also worth knowing that Tirzepatide isn't a controlled substance. The DEA doesn't classify it that way. It's an FDA-approved prescription medication for type 2 diabetes and chronic weight management in adults. There's no regulatory reason for it to be included in routine drug screening. So if you're facing a pre-employment drug test, an athletic screening, or a routine clinical urine test, Tirzepatide is not expected to cause a positive result. It simply isn't on the radar of these standard panels. Now, could Tirzepatide be detected if someone specifically wanted to find it? Technically, yes, but it would require specialized laboratory testing using targeted serum or plasma assays. This kind of testing isn't part of standard clinical practice. It would need to be specifically requested, likely for research purposes. That's not something you'll encounter in everyday medical or employment situations. Here's what's really important to discuss with your healthcare provider. While Tirzepatide won't show up on drug tests, there are situations where you absolutely need to disclose that you're taking it. The most critical one is before any surgical procedure. Tirzepatide affects gastric emptying, which means it slows down how quickly your stomach processes food. This can impact anesthesia risk assessment. Your anesthesiologist needs to know this information to keep you safe during surgery. You should also mention Tirzepatide use during any comprehensive medical evaluation, especially if you're seeing a new doctor or specialist. It's part of your medication history and helps your healthcare team provide the best care for you. If you're undergoing preoperative screening, be upfront about your Tirzepatide use, even though it won't appear on the drug screen itself. The screening is just one part of your medical assessment. When should you contact your doctor while taking Tirzepatide? Reach out if you experience any concerning symptoms or have questions about your treatment. Your healthcare team can provide guidance based on your individual health situation. Also, if you have upcoming surgery scheduled, talk to your doctor well in advance about whether you need to pause Tirzepatide before the procedure. Guidelines around this continue to evolve, so your healthcare team will give you personalized advice. Let's recap the key points. Tirzepatide is not expected to show up on standard urine drug tests because it's a large peptide molecule that these tests aren't designed to detect. You shouldn't encounter issues with employment or routine medical screenings. However, always disclose Tirzepatide use to healthcare providers before surgery or medical procedures because of its effects on gastric emptying. And remember, share your full medication list with your healthcare team so they can provide the best care for your specific situation. Have you had questions about medication testing come up with your healthcare provider? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.